Thyroid or hypothyroidism. Feeling constantly tired, gaining weight without reason, or struggling with mood swings. Thyroid or hypothyroidism. Feeling constantly tired, gaining weight without reason, or struggling with mood swings. Your thyroid could be silently affecting your health. Welcome to WA Health and Care. Today we're discussing thyroid or hypothyroidism, a common thyroid disorder in the UK and USA. According to Dr. James Whitfield, early detection is crucial to prevent complications. Stay with us as we explain its causes, symptoms, prevention, and effective treatments in a clear, trusted way. What is thyroid or hypothyroidism? Thyroid or hypothyroidism, also known as an underactive thyroid, is a condition in which the thyroid gland fails to produce enough essential hormones for the body. This small, butterfly-shaped gland located at the front of the neck plays a crucial role in controlling metabolism, energy levels, body temperature, and overall hormonal balance. According to Dr. James Whitmore, a leading endocrinologist at the Mayo Clinic in the USA, even a slight deficiency in thyroid hormone can affect almost every organ system in the body. In the UK and USA, thyroid or hypothyroidism is one of the most common hormonal disorders, particularly among women over the age of 40. Specialists highlight that the condition often develops slowly, which means many people may not notice the early signs. The thyroid's reduced hormone production leads the body to function at a much slower rate, resulting in noticeable changes in physical and mental health. The most common cause in the USA is Hashimoto's thyroiditis, an autoimmune disorder where the immune system mistakenly attacks the thyroid gland. In the UK, iodine deficiency is less common, but family history, autoimmune diseases, and hormonal changes can all contribute. Certain medications, previous thyroid surgery, or radiation treatment around the neck area may also trigger the condition. At WA Health and Care, we emphasize the importance of understanding how vital the thyroid gland is for everyday well-being. When its hormones decrease, the body's metabolism slows dramatically. This can affect weight, heart rate, digestion, mental clarity, skin health, and reproductive functions. Specialists from the NHS and Mayo Clinic agree that early diagnosis and proper treatment significantly improve long-term outcomes. Because symptoms can be subtle in the early stages, many individuals live with undiagnosed thyroid or hypothyroidism for years. Recognizing the warning signs and seeking timely medical advice is essential to prevent complications such as high cholesterol, heart problems, infertility, and severe fatigue. What are symptoms of thyroid or hypothyroidism? The symptoms of thyroid or hypothyroidism can be wide-ranging, and specialists across the UK and USA agree that they often develop gradually, making them easy to overlook. According to Dr. Emily Lawson, an experienced endocrinologist at the Cleveland Clinic in the USA, many individuals mistake early symptoms for simple tiredness, aging, or stress. This delay in recognizing the signs can lead to significant health issues if not addressed promptly. One of the most common symptoms is persistent fatigue. People with an underactive thyroid often describe feeling unusually tired, even after adequate sleep. This happens because the body's metabolism slows down, making it difficult to maintain normal energy levels. Alongside fatigue, unexplained weight gain is also frequently observed. Even without changes in diet or lifestyle, the slowed metabolic rate causes the body to store more fat. Cold intolerance is another early sign. Individuals may feel unusually cold compared to others, even in mild weather. Skin may become dry and rough, while hair can turn brittle and thin. Many patients also report swelling in the face, particularly around the eyes. Mental and emotional symptoms are equally significant. Specialists note that thyroid or hypothyroidism can lead to low mood, depression, forgetfulness, and difficulty concentrating. These cognitive changes are often mistaken for stress, making proper diagnosis essential. Women may experience irregular or heavier menstrual periods, while both men and women may notice reduced sex drive. Muscle cramps, joint pain, constipation, and a slow heart rate are also commonly linked with low thyroid hormone levels. At WA Health and Care, we highlight that the combination of symptoms, not just one, is what usually points toward thyroid or hypothyroidism. Because these signs appear slowly, many individuals live with them for months or even years before seeking medical help. Recognizing these patterns early allows for timely treatment and prevents long-term complications. What are causes of thyroid or hypothyroidism? Understanding the root causes of thyroid or hypothyroidism is essential because this condition often develops slowly and silently. According to Dr. James Whitfield, consultant endocrinologist in both the UK and USA, most people don't realize they have thyroid issues until symptoms begin affecting daily life. On WA Health and Care, we break down each cause clearly so you can recognize the warning signs early. One of the most common causes in Western countries is Hashimoto's thyroiditis, an autoimmune condition where the body's own immune system mistakenly attacks the thyroid gland. Dr. Whitfield explains that this inflammation gradually weakens the gland's ability to produce hormones, making it the leading cause of thyroid or hypothyroidism in the UK and USA. Another significant cause is iodine deficiency, although less common in these regions due to iodized salt, dairy, and seafood consumption. However, people following restrictive diets or avoiding salt may still experience low iodine levels, which reduces thyroid hormone production. Genetic factors also play a large role. If a close family member has thyroid disease, your chances increase substantially. Endocrinology specialists highlight that thyroid or hypothyroidism often runs in families for generations. Some individuals develop thyroid or hypothyroidism due to medical treatments, such as thyroid surgery, radioactive iodine therapy for hyperthyroidism, or radiation treatment for cancers in the neck and chest area. These treatments may damage or remove part of the thyroid gland, lowering hormone production. Certain medications can also slow thyroid function. Common examples include lithium, amiodarone, and long-term steroid use. According to Dr. Whitfield, patients on these medications should have routine thyroid testing. Finally, aging, pregnancy, and menopause can influence thyroid hormone levels, especially in women. Hormonal shifts may trigger slow thyroid function over time. On WA Health and Care, our goal is to help you recognize these causes early so you can protect your long-term health with confidence. What are prevention and precautions for thyroid or hypothyroidism? Prevention and precautions for thyroid or hypothyroidism mainly focus on protecting the thyroid gland, maintaining hormone balance, and reducing risks linked with autoimmune conditions. According to Dr. James Whitfield, consultant endocrinologist in the UK and USA, many people cannot fully prevent thyroid or hypothyroidism, especially when the cause is genetic or autoimmune, but the condition can be managed early and kept under control through consistent lifestyle habits and careful monitoring. On WA Health and Care, our aim is to help viewers understand simple steps that genuinely support long-term thyroid health. One of the most important precautions is maintaining a healthy and balanced iodine intake. Both too little and too much iodine can affect thyroid hormone production. In the UK and USA, iodine naturally comes from dairy, seafood, eggs, and iodized salt. Dr. Whitfield advises avoiding extreme diets that eliminate salt completely or restrict major food groups, because these can gradually weaken thyroid function. Stress management is another key precaution. Long-term stress can disrupt hormone levels and may worsen autoimmune thyroid conditions like Hashimoto's disease. Even simple daily habits, slow breathing, gentle exercise, walking, stretching, or 5 minutes of mindfulness, can help stabilize thyroid activity over time. Medications also play a role in prevention. Certain drugs, including lithium, amiodarone, and long-term steroid treatments, can slow thyroid function. People using these medicines should get routine thyroid blood tests as recommended by their doctors. Supporting the immune system is equally important because most thyroid or hypothyroidism cases in Western countries are autoimmune in nature. A diet rich in fruits, vegetables, lean protein, whole grains, and healthy fats helps reduce inflammation and strengthens immune balance. Regular thyroid screening is one of the strongest preventive steps. Individuals with a family history of thyroid disease, women over 40, pregnant women, or anyone experiencing symptoms such as tiredness, weight gain, or mood changes should get TSH, T3, and T4 tests every year. This is strongly recommended by NHS guidelines in the UK and Endocrine Society guidelines in the USA. Finally, people who are sensitive to goitrogenic foods or consume large amounts of soy should use these foods in moderation rather than cutting them out completely. Balanced intake supports thyroid health without unnecessary restrictions. What are treatments and medicines for thyroid or hypothyroidism? Treatment for thyroid or hypothyroidism is highly effective when diagnosed early, and the goal is to restore normal thyroid hormone levels to support metabolism, energy, and overall body function. According to Dr. James Whitfield, consultant endocrinologist in the UK and USA, the most common and reliable treatment is hormone replacement therapy, which replenishes the missing thyroid hormones that the body cannot produce on its own. On WA Health and Care, we emphasize that with proper medical guidance, most people with thyroid or hypothyroidism can lead a normal, healthy life. The standard medication for thyroid or hypothyroidism is levothyroxine, a synthetic form of the T4 hormone. This tablet is usually taken once daily on an empty stomach, as recommended by UK and USA specialists. The dose is personalized based on age, weight, severity of hormone deficiency, and any other health conditions. Regular blood tests are essential to ensure the dosage is correct, as both undertreatment and overtreatment can have negative effects on the heart and metabolism. In some cases, doctors may prescribe a combination of T4 and T3 hormones, especially for patients who continue to experience symptoms despite normal T4 levels. In addition to tablets, supportive care may include vitamin and mineral supplements when deficiencies such as vitamin D or iron are present, as these nutrients are crucial for thyroid function. Lifestyle measures, balanced nutrition, regular moderate exercise, and stress management complement the medical treatment to improve overall well-being and energy levels. Patients are also advised to avoid large doses of certain foods and supplements that can interfere with hormone absorption, such as high calcium or high soy products taken immediately with medication. Dr. Whitfield highlights that treatment requires lifelong monitoring, particularly for women during pregnancy, the elderly, and individuals with heart disease. Adherence to prescribed medicines and routine checkups ensures that thyroid levels remain stable and reduces the risk of complications such as high cholesterol, fatigue, or cognitive issues. In cases where thyroid or hypothyroidism is caused by surgery, radiation, or certain medications, treatment strategies are adapted to address the specific cause while maintaining hormone balance. On WA Health and Care, we stress that self-medication is unsafe. Only qualified endocrinologists or primary care physicians should adjust doses or recommend alternative medicines. With early diagnosis, personalized medication, and careful lifestyle management, thyroid or hypothyroidism is fully manageable, and most patients achieve a normal, active life while preventing long-term complications. Thank you for watching WA Health and Care. Remember, early recognition and proper treatment can help manage thyroid or hypothyroidism effectively. Follow your doctor's advice, maintain healthy habits, and stay informed. Like, share, and comment your thoughts to spread awareness and protect yourself and loved ones from thyroid issues.